everyone, I'm Pratiksha. I'm a practicing GP just like you. Today, I just want to show you two Lyrebird features, both leveraging the full integration that we have with best practice. So number one, care plan item number eligibility. Number two, the GP CCMP itself. Now, as you know, care plans historically take a lot of time, and patients come in for a care plan. There's all the administrative work to check if they're actually eligible. You have to log into Proda. There's the two-step authentication. And then there's the actual work itself, like going through the goals and generating the physical paperwork. And this can all take a lot of time. So I just want to show you how Lyrebird can help you streamline some of that. So I'm just going to break this down and show you, I guess, in two steps. So we are clicking on L for Lyrebird. And this is the fantastic thing. I don't have to do any of those administrative things that I mentioned earlier. I don't have to log in to Proda or do any of those checks. You can see that a pop-up comes here which tells us that Margaret is eligible for a GP CCMP, and this is confirmed via Medicare. So we've got here that, you know, she's eligible. We know that before we've even started the consult, which is great. And you may not always leverage this information, but in this case she does want a care plan. So that's the first step. But now that we've confirmed that she's eligible for a care plan, we have to then do the hard work of generating the paperwork after speaking to her. But that's where you're wrong, because it's all integrated and it's already got the context of past medical history, medications, previous care plans, and what the patient now wants to focus on. It really is as simple as a few clicks. So I've got Margaret here, and just to clarify, she's a test patient, so there's no personal data being shown here or anything. And I'll just give you some context. I won't show you the consult itself because you all know how to do that, but just so you've got the context of the consult, what's been discussed and who the patient is. So Margaret's a 57-year-old lady. She's diabetic, she's hypertensive with some high cholesterol, and she is on a few medications. So she's on a statin, she's on an ACE, and she's on metformin, and she's also postmenopausal. So she's come in today and she's really struggling with her diabetes management. She's struggling a bit with her weight, especially since the menopause. And she's actually come in proactively seeking help through a dietitian, which is great. We should celebrate that and help these patients. However, we've all had these scenarios where, you know, we're just too busy, we're running late, we don't have nurse time available, we don't have the capacity to do this paperwork. And unfortunately, that then involves bringing the patient back and, you know, delaying care essentially. But in this scenario, when she's come to see me, I was quite simply able to do all of these things for her in just a few clicks. So I had a talk to her about what she's wanting to achieve, what are her goals, who does she want to see, and we were able to chat through that and generate a GP CCMP. So I'll just take you through how this goes. And again, just to clarify, any goals that are generated, anything that is coming up on the care plan, it is what has been discussed in the consult. It's been pulled straight from there. So I'll show you first of all, I guess, the first barrier that we often face, which is, are they eligible for a care plan? Can I bill one for this patient? So your Lyrebird's listening into your consult, and I wonder if any of you have actually wondered what this column, what this is here on the right hand side. So workflows, these are things that help you maximize care that you can provide for the patient. So if I just do this, then once it's been generated, and you can just have a look through, make sure you're happy with what's actually come through on the plan, which is based on what we have discussed in the consult and goals that the patient wants to focus on. You can edit anything you need to, but the best part is, because it's fully integrated, all you have to do to finish this is just save to BP, one click, and then I'll just show you it has landed up in correspondence, all ready for you to go. send it to her dietitian of choice, diabetes educator of choice, and it's got all the context, past medical history, drug history, and most importantly, the issues and the goals that the patient wants to work on. So it is literally as easy as a few clicks. See with this software, you can see with Lyrebird, patient's eligibility before doing all the hard work and billing an item number, and it also helps you to actually generate the plan itself. Thank you for joining me.